So there's kind of an order to this and how this inflammatory response happens. Again, we're still in that second window there, that second stage of the inflammatory response. So your neutrophils are the first to arrive. They arrive at the site within 6 to 12 hours. They have a relatively short life. They only live like 24 to 48 hours. Basically, they perform their phagocytosis and then they die. And they leave behind them dead neutrophils, digested bacteria, and debris. And that is what makes up pus. We'll talk about that again in a little bit, so don't worry about it right now. But the idea is that it comes quick. Those neutrophils come very quickly. They're the first to show up. They attack, and then they die off. And yes, of course, they're pulled there by chemotaxis. They're all pulled there by chemotaxis, right? Your macrophages or your monocytes, on the other hand. So your monocytes are the second to arrive. They will arrive within something like 3 to 7 days. Sorry, I should have put that in there, but 3 to 7 days. They enter the tissue. When those monocytes, again, they enter the tissue, they become macrophages. Now, some of those monocytes, so let's look there at that tissue injury again here. Some of those monocytes, yes, are being pulled there by chemotaxis. But let's say the injury is here. It actually is, the injury is to the liver. Some of those macrophages are not necessarily being pulled by chemotaxis. They're already there. But some of them are, right? Some monocytes are coming and they're going to turn into macrophages. And of course, their neutrophils are coming. And that's all through chemotaxis, right? These macrophages actually have a fairly long lifespan. They can live for weeks and they multiply. And why that's really great is that they will clean up kind of the mess that these neutrophils have created. Yes, they are definitely cleaning up, engulfing, what's there, the pathogen or the injury or what have you. But they also will do a long-term cleanup of kind of the pus and debris that's been left over by the neutrophils, okay? So remember we talked about, oops, man, it'd be really helpful if my computer stopped freezing. We talked about these white blood cells here. You have probably all seen blood work come back, and you know that when we are concerned about a patient having some kind of infection, yes, we are looking at their white blood cell count, but we're also looking at neutrophils. Neutrophils are a really, really important indicator of infection. And part of what we see a lot, I was telling the other group, I worked in the ER for a little bit at Toronto Gen. I did a placement there. I did a placement there. And this shift to the left would happen a lot, and I'll explain why. So when there is some kind of pathogen, let's just say it's pathogen at this point, okay? Neutrophils are going to that site and they're fighting and they're fighting and they're fighting, but they don't live long, so they're dying off, right? As they die off, those neutrophils are being replaced by other neutrophils that are being created in the bone marrow. So we kind of have these two, not kinds, but you have mature neutrophils and immature neutrophils. Your mature neutrophils, you'll see this on blood work as segmented neutrophils, and your immature, you'll see it on blood work as bands, okay? So what happens is eventually all of those mature neutrophils that are sent to the site are being used up, and the body can't keep up, so it starts sending out whatever neutrophil it has created in the bone marrow. And oftentimes those are immature. They're not actually ready to go to the site yet. And so those immature neutrophils or bands are being sent out into the blood. When that happens, you will see those numbers on your blood work go up, the bands. So you'll see neutrophils go up, of course. You'll see the band numbers go up as well. And what this indicates is that there is some kind of more severe infection because your body isn't able to keep up with sending and creating and sending the neutrophils it needs to fight whatever that thing is. We call this whole process of immature or banned neutrophils being sent in place of mature ones as a shift to the left. When your blood work comes back and you've got tons and tons of bands, it's a shift to the left. This is something that comes up on almost every test, so just make sure that you understand that. I'd be surprised if it didn't come up. Okay, so again, we've talked about these macrophages. One of the cool things that macrophages can do is they can actually join together to make this giant phagocyte. And so macrophages will create this like multinucleated cell that can engulf larger particles. So something there that's not, it's too big for one macrophage to kind of engulf. They will join together and create this multinucleated cell that will, instead of digesting it, it kind of walls it off into this, uses collagen to wall it off into a granuloma, really. That's where, and if you look here, I think your slides talked a little bit more about TB of the lung and how a granuloma in the lung, that this is how that happens. Those larger particles are engulfed by this giant macrophage that's made up of a bunch of macrophages, and instead of digesting it, closes it off, and that's why we end up with, in TB specifically, but also in any case where we've created a granuloma, with this kind of chronic inflammation, right? Because it's not fully digested. It's going to keep triggering and triggering and triggering all of that inflammatory response.